let's get down to business. Give you one more night to get this. We've had a million nights just like this. So let's get down to business. Mama, please don't worry about me. I'm about to let my heart speak. Friends keep telling me to leave this. So let's get down to business. Let's get down to business. Give you one more night to get this. We've had a million nights just like this. So let's get down to business. Let's get down.
Welcome to Lights, Camera, Action with me, Dr. Jin from the Smile Dental Academy. Today's webinar, what we're going to do is cover the fundamentals of dental photography and how you can apply it in general practice for beginners or moving on to those who are more confident using the camera as well. Everything we cover in today's webinar, if anyone's got any questions, wants to reach out, feel free to reach out on social media, Instagram, Facebook, add me drjin.smile. So those who don't know, I qualified from King's College London a few years ago. And since then, I've gone on to do a bit of postgrad education. I did my MJDF, MFDS. I spent 5 years at Eastman Dental Institute in King's Cross, Grayson Road, where I read restorative dental practice. I've also had a keen passion for dental education and education as a whole. So I've done a PG Cert in dental education. I'm a fellow of the Higher Education Academy, PG Cert in leadership, coaching, mentoring. And I've been involved with Health Education England as the ES Educational Supervisor for the past 10 years now. I've been lecturing over the past 12 years at various institutions such as Eastman, Royal College of Surgeons, and at College of Medicine and Dentistry in Birmingham as well. So I work in practice. I'm a general practitioner. I work a couple of days in practice. I also manage a group of practices with Smile Clinic Group. And I've been involved with training young dentists on the interview panel for DFG training as well. And fortunate enough to win a number of awards in the last few years. And quite commonly I get asked, Jin, you know, what did you do to win these awards? And I would say the main contributing factor which helped in my progression, in my success, over the last 10 years has been dental photography. Photography, building a strong portfolio to showcase your work and also critique your work and how you can improve as well. So this is where I work in practice in Essex, where I spend my time, and this is my surgery. And every day I get to morning at work, the first 3 things I get out: my camera, my loupes, and my iPad. And without these 3 things, A, I won't be able to do dentistry effectively. Number 2, I won't be able to educate my patients as well. And photography plays a huge part in our practice with Smile Clinic Group as well. And with photography, I get everyone involved. The patient is involved as an integral part of co-diagnosis and taking their own treatment plan and taking ownership of the dental disease as well. So firstly, let's go through a number of reasons why we would take photographs in practice. So there's a number of reasons we use camera, not just for before and afters for Instagram, as many of you will think, variety of reasons. And the first reason is we all get those patients coming in, especially where I work in Essex. And I'll call this patient Gloria. Gloria is the patient who'd walk in an hour late, be demanding to be seen on time. Even if you're running 5 minutes late, she's already asking, how long is Dr. Jin going to be? And all Gloria wants is whitening and veneers. and this is Gloria. I think Gloria needs to use the right end of a toothbrush first before we move on to any cosmetic options. And again, patients do not see teeth the way us clinicians see teeth. Keep in mind, we've got our patient lying flat down. We've got magnification loops 3 times, 5 times. Some of us using microscopes. We've got LED lights coming through from the ceiling. So the way we see teeth is very different to the way our patients see teeth. And we will need to be able to let the patient see their teeth in a more detailed way. And this photography plays a huge part for them to take ownership of what's going on as well. So in these situations where you've got patients with a number of issues, what I would do, and especially the high needs patients, take a photograph, put it in front of the patient. In our practices, with all our education, we hate the word selling treatment. We prefer you're giving options. And in all our surgeries, we've got a huge, LCD screens, LED screens in front of the patient where we put the photographs up and let the patients have a look and decide what needs to be done and what they would like to be done as well. So photography plays a huge part in patient education, whether it's for caries, periodontal disease, tooth surface loss, or for oral cancer screening as well. Another reason we take photographs is, especially part of restorative work, tooth whitening, is for shade taking. Now, we've all had that patient where you've done some tooth whitening, teeth have gone super white, off the scale white, Simon Cowell teeth, past that white. And the patient will say, Jin, my teeth haven't changed color. Why have they not changed? We need to be taking photographs before and after. So shade taking, huge part, especially teeth whitening and restorative dentistry as well. But have a think about it. If you have a look at this photograph in front of you, what are the issues when taking photographs or shade taking? One of the big issues is we get a lot of glare, a lot of distractions in the image from the flash itself. And you can see that on the screen itself, where the flash has gone off, it can distract us from the actual underlying color of the tooth as well. So another tool we can use for shade taking are polarizing filters. So Polarize is by PhotoMed. You can buy that online. And again, it's a very nice bit of kit that we can apply to our camera. It fits on, as you can see, onto the lens and flash. And what this will do is get rid of that distraction. It will polarize the light. So you can see on the image, on the left-hand side, you've got non-cross polarized photograph, so normal picture. On the right-hand side, using a polarized filter. And what this does is gets rid of all the glare, so you can see the image nice and clear. And I use the polarized filters quite routinely for any restorative work with anterior teeth, but even more so this day and age with composite bonding. And a lot of clinicians are doing anterior bonding to decide which color composite to use. I would get a variety of different shades, put that on the tooth, no etch, no bond, and light cure the composite. Then you can have a look with a cross-polarized filter to have a look at the underlying shade and which one of the composites is the best match for your case. So again, polarizing filters work really well in practice, and I would recommend them as well. Another reason why we would take photographs in practice, CV and personal portfolio. Now, we've got a number of practices. Our London practices are more popular, especially Northwest London. We put a job out a couple of weeks ago for our Northwest London practice, and we had 400 CVs come through. 400 CVs in a week. And majority of the CVs all look the same and all sound the same. I want this many, I've done this many tooth colored fillings, I've done this many root canal treatments, I've done this course, that course. Everything was very similar. What stood apart those people applying who had a really good case were their portfolios. So a number of the applications we had a PDF attachment with their own clinical portfolio. And this reminds me of one of my good friends, Mujj, who applied to work in Doha. So a lot of you guys watching this webinar may want to work internationally, may want to move to different cities. And Mudge trained with me at the Eastman. And when he applied to Doha, he applied to the most expensive practice in Doha, the most prestigious practice. And when he went there, he took his portfolio. And it was this portfolio that stood him apart from the rest of the dentists applying. And again, this doesn't need to be gold standard, high-end dentistry. This needs to be good work that you're proud of. And this will also show that you're a reflective practitioner that wants to improve. And I would recommend, whichever stage of your career you're at, start developing your own portfolio. And you can also look back at it and see how much you've improved over the years as well. So what we're covering in this webinar today is photography and the consistency of it and where we can apply it as well. Now, when I learned photography over 12 years ago, major use of photography back then was for medical records. I remember sitting at Eastman, having my photography lecture, and it was all about medical records and how we use photography. But now in 2021, the world has changed. Marketing, Instagram, Facebook, websites, everything has changed where you need good, consistent photographs. And the caliber of photography being taken by dentists across the globe now has actually pushed boundaries to where we can see the differences. And those who are taking nice, reproducible photographs are showing their cases off really well. So again, consistency, before and afters. And if any of you guys have any questions of what apps I use, watermarks, framing, stuff like this, feel free to drop me a message and more than happy to help you guys out. So again, this case was a peck-shaped lateral done in practice, which again, a lot of the other guys in webinars will cover the clinical aspects of composites as well. Again, composites, before and after, framing, exposure, focusing, keep all these consistent and your photograph will look good as well. Same with this photograph. Now, this was a case we did in practice, lower, so upright 5, upright 4, which needed a composite filling, old worn down GIC, before and after, and again, anatomy, but again, photography wise, framing, exposure, and making sure your framing is correct as well. I'll also be covering the use of light in photography and how we can take photographs like this as well. And again, all these photographs taken now are by delegates of our previous courses, done hands-on. And again, nice up close, showing burrs, extractions, the extirpations, instruments, and again, a fantastic picture taken by one of our delegates, Farhad, from our course last week as well. So what's the main thing I want to drill in today's webinar? It is this: consistency. We want to make sure the whole technique we use in dental photography is something that we can reproduce. And we're looking at 3 main things. Firstly, we're making sure everything is focused. So what I mean by that is we want to make sure everything in the image is nice and clear. If we're taking a smile shot, we want the molars in focus as well as the centrals. We don't want anything blurred or out of focus. Next thing we're looking at is the framing. So if we're taking, again, a picture of the upright 1, we only want the upright 1. We don't want upright 1, bit of cheek, bit of nostrils, bit of the eye. Your framing needs to be correct. And the final thing we're looking at is exposure. What we mean by that is we don't want your image to be too light or too dark. So in today's webinar, this is going to be the running theme: consistency, focusing, framing, and exposure as well. So quite commonly I get asked during my courses, Jin, why can't I use my camera phone, iPhone, Android, Samsung? Why can't I use this to take pictures of patients? Now, the only time I would use my iPhone to take pictures is for Invisalign. And that is for the initial photographs to get them uploaded. I will still take strong DSLR photographs for the case, but the initial ones, I would probably use it with my iPhone. And there's a lot of differences when using iPhone and DSLR. So this is Chantel. Chantel is one of our nurses in the practice. These two images are taken a couple of seconds apart. Top one is taken with my iPhone. Bottom one is taken with a DSLR camera, digital single lens reflex camera. Have a look at the differences. What can we see? Firstly, let's have a look at image quality. The quality of the image is very different with your smartphone and DSLR. Next thing is the depth of field. So if you look at the smartphone photograph, it's more rounded, fisheye effect. Whereas if you have a look at the DSLR, much more wider, more depth of field. Again, like for like representation is different. And again, the reproducibility is different with both as well. So I went to Dental Protection many years ago and asked them, can I take pictures of patients with a camera phone and send them to colleagues, specialists for an opinion or advice? And they said, you know, Jin, you've got a couple of issues here. The first issue is medical record. So as soon as you take a photograph, that forms part of the patient's medical record. Now, where should medical records be stored? They should be on site, locked away, password encrypted. Our phones are with us all the time, in our pockets. Some may not be password protected. So again, that's an issue. When it forms part of the medical records, the patient has access to it at any time they want. So some of you may be working in a practice now, a year, 2 years down the line, you may move on to another practice, but the patient knows you've taken that photograph and should be able to have access to that photograph at any time. So again, that causes an issue as well. There's also issues with confidentiality. If these images get leaked anywhere, that will be an issue. And there's been a number of cases in the media where celebrities' photographs from iCloud have been leaked elsewhere. So confidentiality is an issue as well. And finally, encryption software. Is our computers encrypted? Our phones encrypted? So I know WhatsApp is encrypted. I know some email servers have to be encrypted. And again, if you're sending emails of patient records, they need to be from a secure server, from an encrypted email address as well. And again, this all forms part of GDPR. So I'm not going to bore you to death with GDPR, but again, Data Protection Act 2018 as well. So what we're saying with this, you must not participate, or make any recordings against the patient wishes, or where a recording may cause the patient harm. And if you're going to take any recording of a patient, any photograph of a patient, any testimonial, you must gain the patient consent. And there's a number of consent forms available. And if anyone wants anything, feel free to drop me a message as well. So what this means is if you're going to put anything on the World Wide Web, if you're going to put anything on the internet, YouTube, Instagram, Snapchat, social media, again, gain the patient's consent. And a couple of things I would note when you're gaining consent. In your consent form, make sure you write down, patient is aware that no financial compensation is available for use of their pictures. I know a lot of you guys watch Love Island. I mean, where we work, your patient may be your patient, you know, a couple of years down the line may end up on Love Island as a Z-list celebrity and may ask you for some payment. So make sure you have that in your consent form. And again, in terms of social media, having your consent form that once it does go on social media, you may not have any control of where the image will end up. So what are we trying to achieve? Consistency. This is what I'm going to be drilling in today's webinar. We want the whole technique to be one we can reproduce. Looking at three things: focusing, framing, and exposure. Making sure our image is focused, is clear. Making sure framing, we've got the area of interest framed. and making sure our image exposure is correct, not too light or not too dark. So let's have a look in what's in our kit for dental photography. So first thing we've got in our kit is at the body of the camera. This is the main bulk of the camera, the body of the camera. We are using DSLR cameras, digital single lens reflex camera. And the two main types available, or what most people use, which is your Canon or Nikon. Now I use a Canon 80D. With Canon cameras, the lower the number, the more expensive, more fancier and heavier it is. The higher the number, easier it is to use, and I would say lighter and cheaper as well. So again, I would recommend go try these cameras out before you buy them. And again, drop me a message, more than happy to help you out, depending on what level of camera you want. The next bit of kit we've got is the lens. And this is the single most important part of the camera. The more money spent on the lens, the better the photographs will be. And in dental photography, we use macro lenses. So when you buy a camera, it will come with a recreational lens. You need to buy a separate macro lens. And there's a variety of different makes, Canon, Sigma, Tokina, loads of different makes available. And you've got 60mm macro lenses, 100mm and 105mm. So a lot of you people be wondering, what's the difference? What's the difference between the 60mm and 100mm? So here we've got a ladybird sitting on a leaf. And to get the same image with a 60mm lens will be much closer. So the working distance with a 100mm camera is much better. You're more further away from the subject. With a 60mm, it's much, much closer. As you're closer, that will affect the image as well. So let's have a look at a photo here. Both photographs, same patient taken a couple of seconds apart. Same body of the camera, same lens, but we're using a different 60mm for the top one and a 100mm lens for the bottom one. And again, same flash as well. So differences we can see. Firstly, with the top image, a 60mm lens, your depth of field is different. If we have a look at the buccal corridors, we can't see the fives that clearly. So again, you're going to get that rounded fisheye look as well with a 60mm lens, whereas the 100mm is much more wider image as well with a wider smile. And again, recommendations, I would say 60mm lens is lighter, cheaper, and more versatile, and I would say it's easier to use for an introduction to photography. The next thing we've got in our kit is lights. Now, we don't use a surgery light, we don't use a chair light, we use flashes. And the first flash I would recommend for anyone starting out with photography is a ring flash. So the ring flash attaches to the front of the lens. The ring flash has got two sides, one on the left and one on the right, and it shoots out the light down the middle of the camera. And again, it's quite simple, easy to use, and this is exactly what I'd recommend for a beginner in dental photography. The next level up are your twin flashes. So again, two flashes, but with this time, they're slightly further out and you can actually move them and angle the light as well. The fact that you can move the light, they're a bit more technique sensitive, and I'll recommend it to anyone intermediate level who wants to increase the level of dental photography. You can also get little soft boxes. So when the light comes out the twin flash, it can be a bit harsh and sharp. So the use of soft boxes will soften the light up and diffuse the light slightly as well. So again, soft boxes, and these are not expensive. You're talking 10, 15 pounds, Amazon, eBay, a lot of other suppliers available. That's what I'd recommend. And then the next level up, and some practices have full-on photography suites. So you can have the full backdrop photography suite for headshots, ring lights for your testimonials available as well. And a lot of you thinking this must be expensive, Jin. Again, you're looking at about 100, 150 pounds. If you want for a setup like this, it's not expensive as long as you got the space in the practice. Now, I know a lot of people be thinking, what's the difference between ring flash and twin flash. So we've got two images here. Top one is taken with a ring flash. The bottom image is taken with a twin flash. What differences can we see? So the first thing, if we look at the bottom image with a twin flash, we can see a lot more colors, a lot more translucency, more clearer line angles on the image. So there's certain indications where I would recommend a ring flash over a twin flash. If you're doing shade matching, shade taking, use a ring flash. For everything else, I would recommend twin flashes as they will help your photographs look nicer and better as well. So we've got body of the camera, we've got the lens, we've got our flash. Next bit, we have got cheek retractors. Now, these type of cheek retractors, I would say keep them to Christmas parties. I would say the one I tend to use are the ones you can buy like this. Again, you can get double-ended ones, which are easier for younger patients with smaller mouths and older patients, larger patients with much wider mouths. And again, you need to get everyone involved in dental photography. So what I mean by that is the patient needs to hold the cheek retractor. They can retract their cheeks much more comfortably than us, the dentist, try and tug on them as well. Next bit of kit I got is a lip retractor. So when you're taking occlusal photographs, to avoid the labial surface of the lips touching the teeth, we use a lip retractor. Again, 15, 16 pounds, really useful, and that will retract the lips out the way as well. Next bit we've got our mirrors. So we've got buccal mirrors and you've got occlusal mirrors as well. And occlusal mirrors are used for your occlusal photographs. You cannot take occlusal pictures without occlusal mirrors. Now, when you're using mirrors, keep in mind, everything is flipped around. So you need to adjust it on software afterwards as well. And the last bit of kit we've got is your contraster. So I get a lot of people asking me, Jin, what software do you use to put the black background in your images? Again, pictures like this are taken with a contraster. The before image with a contraster, after image with a contraster, then you can obviously merge them on some software, which I will recommend. Contrasters, again, if you haven't got one of these, they're about 15, 20 pounds. You can use the back of an X-ray film, which has got a matte finish to it, and that will help to give these images as well. And again, this is work done by my colleague Kish, who's a talented restorative dentist. And in this case, it was composites done. And again, these type of pictures are shown off really well by using contrasters. And we use them quite routinely for any anterior work we do. So that is the part of the kit. That's what I've got in my kit, and that's what I'd recommend. And again, the beauty of everything available now on eBay, Amazon, you don't need to spend a lot of money to get hold of your kit. Again, some of you may want to buy your your camera, body of the camera secondhand. And again, that's available out there as well. And I would say keep for your first camera, keep the cost low. As you improve, as you get more into photography, then you can buy the right bits of kit that you want. So let's go through all the settings now with our cameras. So if any of you have got your camera with you, this is the time to get it out, open the camera, get all the little bits together, and we're going to work through the settings of the camera. So the first thing, let's have a look at the flash. We are using a ring flash. Our setting for the ring flash is ETTL, which means electronic through the lens. This is an automatic setting of the ring flash. So what that means is communicating with the camera, working out how far we are from the patient, and making sure the flash is consistent with that. So for better performance, if you use the same make lens as your ring flash, it will work better. On the ring flash itself, if you have a look at the image, you've got the little button or it says charge. What that means is the battery is getting ready to fire. If the red light is not on, your battery and your flash is not ready. So that red light needs to be on for it to flash. And again, on the flash itself, you can actually increase the exposure, increase the amount of flash, and you can decrease that as well. But I will set it to 0 at neutral and use it on ETTL for beginner entry level. So that's our flash all set up. Next thing, we're going to turn the camera on and put it on manual mode. Manual mode, which is M on the top of the camera, so you can move it around and put it on manual mode. And the reason we're going to put it on manual, we're going to work our way through every different setting to optimize it for dental photography. And when I started dental photography 12 years ago, the thing that confused me the most or scared me away was this screen here. All these numbers, all these settings just scared me away. So what I want to do today's webinar is break it down and simplify it for everyone so they know exactly what setting to use. And we're going to call this our home screen. This is all our settings, our home screen. So first thing, what we're going to set, you'll see a little button called AF, which is your autofocus button. You want to set that to one shot, single shot. So on different cameras at the different places, have a look at where is it on your camera. You want to set autofocus to one shot. Next thing we're looking at is white balance. So white balance is the automatic correction of variations in the color temperature of the ambient light. So what does that mean? What that means is if I've got a white piece of paper here, we all know it's a white piece of paper because we're humans. In our brains, we got it built in. Piece of paper is white. Our cameras don't know that. In certain lighting conditions, it may look a bit orange. If we take it out onto the street today, it may look a bit blue. So the cameras don't know what temperature of light we got available in the room. And we need to tell the camera what the temperature is. So the different settings for white balance. And we want to set it to a setting that is daylight setting. So if we have a look at the different settings for white balance, daylight setting on the top left, as we go through the different settings, it's got different Kelvin temperature of light. And this is a different white balance. So for example, if you're using a fluorescent one, it will look slightly more yellow. The tungsten one, slightly blue. What we want to set it to is daylight, which is approximately 5,200 Kelvin. So the way you do that is click WB, which is white balance, flick through the setting and click on daylight. And you'd be glad to know as we're going through all these settings, once they are set, they're set for life. You don't need to change them anything afterwards as well. So the next thing we're changing, we're looking at ISO. So have a look at the home screen. You'll see a little number ISO. This is the International Organization for Standardization. What does that mean? This is the sensitivity of the digital sensor. So most of our cameras will go from 100 to nearly 12,800. Big variety. ISO 100 is the sharpest image. As it increases, the image will become lighter as well. So as we increase in the ISO, the image becomes lighter. But as it becomes lighter, it may become grainier. Now, in our modern cameras, they're not going to be that grainy. You're not going to see it. I would recommend setting the ISO to 200. And the way we do that is you hold the ISO button. Some of your cameras, it may be touchscreen. On our camera here, you can see it on the top there, ISO on the top right. Hold that button down and spin the dial on the front. And you can set it to 200. Again, you'd be glad to know, once this is set for life. And again, these settings I'm giving you, these are not Jin settings that I came up with. All the courses, all the education I've done, all the reading I've done, whether it be in the UK, US, BACD, with Eastman, King's, these are still pretty much universal settings for dental photography. And then you can adjust it slightly depending on your photograph or the setup you have as well. So next, let's go through the menu display options. So if you click on menu or display options, first thing we want to have a look at is image quality. There's a couple of different options available. So what you should be able to see on your camera is this. You've got L, M, S, you've got RAW. So what does this all mean? Your L, M, and S are all JPEG files. So JPEG is a type of image file. RAW is a different type of image file. Our cameras can save it either as a JPEG, either as a RAW image, or both together. I would recommend saving as a JPEG. Only save it as RAW if needed for any examinations or any institutions. And again, when you're saving it as a JPEG, save it as a large JPEG. And then you've got two options. You've got a sort of a smoother finish semicircle sort of thing, or quarter of a circle. And you've got one with steps. This is the smoothness image quality. So again, I would set it on the first one, which is L, with the smoother finish. Next thing we're looking at is our color space. So with color space, what are the options? You've got two options available: Adobe RGB and sRGB. So what are the differences? Adobe RGB is a much broader spectrum, much wider spectrum of colors. sRGB is a shorter spectrum, more vivid colors. So when we're taking dental photography, we want all the natural colors to come through. So imagine you're taking a photograph of an upper right one for shade matching. You want all the natural colors to come through of the image. Hence, you want to set it to Adobe RGB. So if you click on color space and set it to Adobe RGB. And again, you'd be glad to know every setting you're setting so far, once it's set, you're set for life. Next setting, we are looking at shutter speed. So shutter speed is the amount of time the shutter is open to allow light to enter to record the image. And this is measured in seconds. So you've got 1/60, which is 60th of a second. Now, when we're doing dental photography, we're not using tripods. We're holding the camera with our hands. Hence, we need to be very still. Anything below 30th of a second, as humans, we find it quite difficult to hold it still, and you will get a blurred image. So as we can see here, as the shutter speed is decreasing, now we can see more movement, but as the shutter speed is decreasing, more light is entering the camera. And again, we're going to be covering general photography tips as well. And by altering the shutter speed, that is how we get images like this, where everything static stays in place, but the cars are all moving because of the altering shutter speed. And the same way photographs like this, or more commonly the ones you see in New York or the cabs, those are all taken with altering shutter speeds because they use tripods. What we want to set it on is 1/200 of 200th of a second. And the way we set the shutter speed is by moving the dial on top, and you want to set it to 1/200, which is 200th of a second. And again, every setting we've done till now is set for life. So anyone who's been sleeping, not paying attention, now is your time to wake up. The next two settings we need to know how to change depending on the picture we're taking. So the first setting we need to know is our aperture, which is our F number. So have a look at the back of the camera. You'll see a number, F something. This is your f-stop, which is your aperture, the size of hole letting light to enter. Larger the F number, smaller the opening, larger the depth of field. Smaller the F number, larger the opening, smaller the depth of field. So let's have a look at F16. F16 is a larger F number. You've got a larger depth of field. Standing in front of a mountain, everything is in focus. Larger depth of field. With a smaller F number, 1.4, only the subject is in focus. The mountain behind is out of focus, smaller depth of field. And I know a lot of you may have taken pictures, nice smile shots or retracted pictures. Central is all focused. Molars are totally out of focus. And this is because you've got the wrong F number. Again, the F number is too small, which means you've got a smaller depth of field. We need a larger F number for a larger depth of field. So moving to F22, now we've got a larger depth of field, larger F number, everything is in focus. And the way we change our F number is by holding the aperture button. So it's like a little AV button, the aperture button, and moving the dial on top. And that will change the F number. And everyone needs to be comfortable changing the F number. In dentistry, we've got two main numbers we use. We use F11 for full headshots, and then F22 for everything else. So F11 for headshots, F22 for everything else. So the first thing we need to change, depending on what photograph we take, is the F number. The next thing is the magnification. So if you have a look at the barrel of your lens, firstly, we want to make sure it's set on MF, manual focus. You do not want it on autofocus. We want to fully customize the camera and optimize it for dental photography. And these ratios are ratios of the image to real life. So for example, if we've got 1:1 setting, you've got a 10mm upper right one. On the image, on your computer, it's going to be 10mm. If you've got a 1:2 ratio, if it's 10mm upper right one, it will be 5mm on the image. The maximum our DSLR cameras can do is 1:1. If we're looking at the bottom one where it's 2:1, we're actually zooming in, you're looking at microscopes and things like that for this. So these are the magnification ratios. And again, as you move the barrel of the lens, you will see the ratios changing where the marker is set. And we've got set ratios we use for set photographs. So magnification is to do with ratios of the object to the image. And by using all this, and again, I'm drilling the same message in, we want to keep the whole technique consistent. Technique that is something we can reproduce every time. So we're talking about focusing, framing, and exposure. So let's have a look at our settings for the pictures. The first photograph is our headshot. So for the headshot, full face view, magnification, 1:15 or infinity. So have a look at the barrel of the lens, put it on infinity. You want to hold the camera on portrait on its side. And you want to put F11, your F number is F11. And again, you want to use a plain background. So in our practices, most of our surgeries have a black roller blind behind the doors, which you can roll down. You can put a black piece of card behind the patient, but you want a neutral background. When you look through the viewfinder, you want to focus on the bridge of the nose. You want to make sure the middle of the camera goes through the pupils. You want to make sure you include at least from the chin to the top of the head. Even if they've got spiky hair like me, you need to include that in your image as well. And this is the only photograph you may want to adjust it slightly, which means move the barrel slightly to focus your image. Next picture we've got is our smile view. So this is your money maker shot, which most of us will want to take for social media. Your F number is F22, magnification 1:3. You need to include lip line, smile line, teeth, and buccal corridor. And when you look for the viewfinder, you want to be looking at the laterals. Once the laterals are all focused, take the picture. You want to make sure the middle of the camera goes through the midline. Again, You want to be coming at a right angle to the patient. You don't want to be coming too low, where it will create a negative smile line, or way too high, where it's too positive. So you want to maintain a neutral positioning as well, recreating what the patient has. And again, once you look through the viewfinder 1 to 3 f22, you can always crop the photograph afterwards as well. The next picture we've got is a smile view lateral. So the camera has stayed the same, 1 to 3 ratio, f22, but all we've done is moved around the patient now. And we want to focus on the lateral. And what you should be able to see is lateral, central, central, bit of the other side's lateral. If you can see the canine on the other side, you've gone too far around. This photograph is an anterior smile view. This is not your buccal photograph. And I use this quite routinely to show my relationship of incisal edges to a lower lip. If I've done any short-term orthodontics, Invisalign, QST, any veneers, composite bonding, this shows off your work really well. Next photograph is our retracted view frontal. Again, you can see the camera has stayed the same, 1 to 3 ratio, f22. Cheek retractors have gone in, and who's holding the retractors? The patient. You want to make sure the patient is biting down in ICP, intercostal position, comfortably biting down together. You don't want the photograph to show that the patient's got any anterior open bites. And again, make sure the midline is going through the camera and the occlusal plane is at a neutral position as well. Now we've gone close up. So we've got the cheek retractors or lip retractor placed inside. Magnification, we've got 1 to 1.5. And your F number is F22. And the contrast that goes behind the teeth. So what I normally say is 1 to 1 will give you 1 central or centrals. 1 to 1.5 will give you 2 to 2. 1 to 2 will give you canine to canine. And then 1 to 3 is your smile shot. Moving on to the occlusal photographs, perhaps the most difficult pictures we take. So let's have a look at the upper occlusal first. For the upper occlusal, you want the patient lying flat down. So patient's in the dental chair all the way down, slightly declined. You want the chair down as possible. You're going to be behind the patient. Patient is holding the lip retractor, and the nurse is holding the mirror and 3-in-1. So let me go through that again. Patient is lying down flat or slightly declined and low as possible. You are holding the camera as the dentist. Patient is holding the lip retractor. Nurse is holding the mirror and 3-in-1. And make sure the nurse knows what the water is or what the air is. Even last week, Nat sprayed the patient with loads of water instead of the air. So make sure they know which one difference is as well. And again, every time we use the mirrors, keep in mind everything is flipped around. So you'll need to rotate it and flip it around afterwards. Again, make sure you dry your teeth using gauze before you take the images. And again, if you want to do any quadrant pictures, for example, you're doing a occlusal caries or an onlay of the upper right 6, same principle, patients lying flat down, 3-in-1 tip, mirror up with the nurse, lip retractor, and instead of doing 1 to 3, you could do 1 to 2 and just do that one quadrant with F22 as well. So same settings, again, using the mirror as well. Let's move on to the lower occlusal. So lower occlusal, we are now in front of the patient. Patient is sitting at 45 degrees or upright. So patient is upright or 45 degrees. We are now in front of the patient. Nurse is holding the mirror and 3-in-1 tip. Patient is holding the lip retractor, and you're taking a photograph from in front of the patient into the mirror. And keep in mind, you're going to flip everything around. A little tip I'll give you when you're doing occlusal pictures, same little tip I use for my x-rays and for my impressions. Lift the chin up, similar to what we learn in basic life support. Chin up, you are opening the airway, patient can breathe more comfortably, and it helps as well. So chin up to open the airway to take these pictures. And once these settings are set, once your setting is set, for example, for your occlusal picture, 1, 2, 3, F22, you move yourself backwards and forwards from the patient until everything is clear on the viewfinder, and then you take the picture. So once settings are set on your camera, you move forwards and backwards from your subject, from your patient to focus. I don't want any of this moving around as if you're at a party or a club. You want to move yourself backwards and forwards until it's focused on the image, on the viewfinder, then take the picture. This way you're keeping the whole procedure consistent, one which you can reproduce every time. So if I've got a patient in front of me, I want to take a smile shot. I know my settings are 1, 2, 3, F22. Look for the viewfinder, backwards, forwards until you're happy, it's all clear, snap away. Do not move anything around once the camera is set. And by doing this, we are, linking it back to this, keeping the whole technique consistent and one which you can reproduce. And as soon as you take a picture, have a look at it. Is my focusing correct? Is my framing correct? And is my exposure correct? If all three tick off, move to the next picture. If any of those don't tick off, take the photograph again. It's much quicker and easier taking a new picture than trying to mess around on Photoshop afterwards. So these are the 6 general photographs recommended in general practice. So we've got our headshot, smile shot, retracted picture, teeth apart retracted, upper and lower occlusal. So headshot, smile shot, retracted, teeth apart retracted, upper and lower occlusal. So for some of our practices, patients come in for a checkup, they'll have these pictures taken, intraoral scan with the arterial scanner, and then we'll present it to the patient. For larger cases, what recommended photographs are these 15 pictures as a baseline. So you got headshot, smile shot, you got your lateral views, moving on to retracted lateral, teeth apart lateral, upper lower occlusal, and your contrasted views. So these are the 15 pictures we would take in practice as a baseline. And then depending what the case is, I will always do a lot more. So if you're doing composite work, I'll take it at different stages. If you're doing any root canal work, rubber dam on, all those stages, and that will just supplement your portfolio as well. So you've got the 6 general pictures and 15. So those of you who've been following with your cameras, this is your time now to go and take your 6 general pictures to review afterwards as well. Moving on to infection control. All these cameras are very intricate with detailed parts. So we're going to make sure we're looking after the camera as well. So whatever protocol you're using, whether it's gloves, I tend to use barrier wraps, make sure you've got some procedure, how you're looking after infection control. Recording the image, we've got different file types which we've covered. We've got the JPEG and RAW images. When you're transferring images to your computer, so I tend to still use SD card reader. You can either wire your camera in, or you can use something called an iFi card. Now, a lot of the new Canon cameras are already Wi-Fi enabled. On your iPads, on your Apple iPad, you can get an app, Canon app as well. So as soon as you take a picture on your camera, it's already onto your iPad. And my workflow, a lot of you guys are thinking, Jin, what's your workflow? I've got an iPad in the practice. I've got a huge 50-inch screen in front of the patient. The screen is connected to the iPad via Apple AirPlay, Apple TV. So as soon as I take a photograph, it's on the iPad, which is on the TV. The iPad, I can use a pen and the patient will annotate their own teeth of what they like and don't like, and that will be able to be seen in front of them as well. So that's my workflow. In terms of the order I take the photographs, headshot first, moving on to smile shot, all the retracted pictures, contrast the photographs, lower occlusal, and the last thing I take is my upper occlusal, because that's the only time the chair will drop back down and back up again. So have a consistent way of taking photographs. Once you get into a good routine, I can take a full set of pictures in a couple of minutes. But again, you're not going to learn everything from a couple of hours webinar on photography. You need to practice. So if you've got a gap in your diary, patient hasn't turned up, during lunch, practice on each other, on your staff, on nurses, on the dentists, to get consistent and better with your photography. And photography is a lot about confidence knowing the settings, knowing where all the buttons are, and the more you use it, the more confident you will feel. So the last bits I want to go through are image issues. If the image is too dark, decrease the F number. Other option is you can adjust the flash to overexpose. If the image is too light, you want a larger F number or underexpose the flash. Now, if you're going to go and buy a camera, a lot of factors go into the play of when you're thinking of what to buy. I would recommend firstly go into store, whichever store is local to you, to try out the camera. So you want to check the construction of it. You want to check how simplicity of it, how easy is it to use, how quick can you use it. The versatility, I would say weight plays a huge part. Some of these cameras can be quite heavy, which some people may not like. Price, how much you want to spend, and what hardware you got at home as well. So there's a variety of places where you can buy your camera and your extra equipment. In the UK here, we use John Lewis, Amazon, DB Orthodontics, Dental Directory, Henry Schein, eBay, a lot of variety of options. And I would say research. If you're buying your first camera, don't go crazy spending a lot of money. Get something which you're comfortable using. And then the second camera, you can spend a bit more depending on what your needs are. Some of you may use the camera recreationally, wildlife photography, at home with the kids, family. So get the right camera that will give you a long span as well. And again, dental photography plays a huge part. Some of you may want to go into digital smile design. None of this can be done without a good set of photographs. So whichever course you embark on in the future, whichever program, whether it's orthodontics, implants, restorative, aesthetic, you will be doing photography. So my recommendation is get comfortable and make it part of your routine. If you fall into bad habits early on with photography, rubber dam, retraction cord, all these little things you're not going to use in the future, and it's going to cause a problem in your practice as well. And with photography, you want to integrate it into your marketing and clinical care. And as I said earlier on, we're not selling treatment. We're giving patients options for treatment. Put the image in front of them. You're co-diagnosing, working with the patients, giving the options. But the patients will pick up, Jin, I don't like these fillings at the back. I don't like the gap at the front. I don't like the worn gums or the receding gums. All these things can be picked up by the patient. What I found in my practice is the patient tends to pick up even more than I would say to the patient. So again, co-diagnosing, working with the patient. And again, if you're not going to use your retractors for dental photography, you can do what they did in Paris Fashion Week a few years ago. All the models walked out with cheap retractors. So again, I've been Dr. Jin, and we've done dental photography, lights, camera, action. Any questions you have about the webinar today, feel free to reach out to me on Instagram, which is drjin.smile. And I'll answer your questions. If anyone wants any handouts, any consent forms, feel free to reach out as well. And the main thing is use dental photography in your practice to grow your practice and you grow your clinical skills as well. So wishing you all well, stay safe, and God bless.